Welcome to Healthcare Mixtape, where we're curating the ultimate playlist of healthcare content that you may have missed the first time. Here we share bonus episodes and greatest hits from some of our favorite shows, as well as exclusive interviews with industry insiders, all focused on healthcare changemakers and the disruption of the now. This show is produced by Shift Forward Health, the channel for changemakers. Subscribe to Shift Forward Health on your favorite podcast app, and you'll be subscribed to our entire library of shows. One subscription, all the podcasts you need, and it's all for free. I'm Jared Johnson, your playlist curator, and it's time to mix it up. All right, the next in our greatest hits playlist is an episode of the Innovation Accelerator podcast by Innovacer. The topic was the shifting state of healthcare consumerism. It was hosted by Steve Ambrose, and I was a member of the panel along with Gary Druckenmiller and Beth Bierbauer. Gary is the managing director of PRM at Innovacer, and you heard Beth on our last episode. She's the host of the Be Time podcast. We shared where consumerism has been, where it is now, and most importantly, where it's headed and how to thrive in an industry that's changing faster than ever. I encourage you to subscribe to the Innovation Accelerator show, and I hope you get a lot out of this episode. Check it out. Let the mix begin.
Welcome back to the Innovation Accelerator podcast. I'm your host, Steve Ambrose. Many industries across America are driven through cost, quality, and convenience, and they engage with consumers through free market forces such as supply and demand. So what happens when the biggest industry in America meets up with a growing surge of consumerism, as well as new expectations from its purchasers and its users? Well, today's show is going to help answer that question, along with many others that are in the minds of patients, employers, and healthcare organizations. On our panel today are Beth Bierbauer, a sought-after thought leader in consumerism. Beth has served for more than 30 years for many of the top payers across the country, including her most recent role as president of Humana's Employer Group segment. Joining Beth is Gary Druckenmiller, patient relationship manager at Innovacer. And rounding out the panel is Jared Johnson, the founder of Shift.Health, an influential thought leadership network for B2B healthcare and health tech communities. Really happy to have you all on today. And before we get started, I'd like each of you to share a little bit about yourselves with our listeners and our viewers. And we'll start with you, Beth.
Thanks, Steve. And I am thrilled to be here. As you mentioned, my career has really been on the payer side. I have worked for organizations such as Coventry Healthcare, Humana, and Highmark Blue Cross Blue Shield, and have served in a variety of roles. And now I serve as a strategic advisor, working with startups mostly.
Thanks for that. Gary?
Thanks, Steve. Gary Druckenmiller, and I'm the GM at Innovacer for our PRM category. Some might call it CRM, but essentially it's all about consumer experience. And for the past 12 years or so, I've been at this intersection of consumerism, starting with an organization called eVariant, which was one of the first startups in the CRM space, dating back to 2009. And that eVariant got acquired by Healthgrades, and that got me to Innovacer. But prior to that, I spent my time outside of healthcare in CPG, hospitality, and that was the ringer for me actually entering into healthcare, was to kind of bring real consumerism into the hands of those that need it most on the healthcare side. So best time to be in healthcare is right now. Thanks, Steve.
And Jared.
Thanks for having me on, Steve, and great to be on this panel with Beth and Gary. Most recently, I've been involved with a lot of podcast production. I figured out the other day I've produced over 500 episodes of various podcasts, all in the healthcare space, and some with some amazing guests and perspectives, all having to do with how to make healthcare more consumer focused. Personally, what drives me is, besides more than 15 years in various healthcare organizations, payer, provider, health tech companies, what drives me personally is to try to make healthcare easier, less expensive, more convenient, all the things that we hope are the hallmarks of our customer experience in other industries. That keeps me going.
All right. Well, thanks everyone for that. Let's jump right on in. And the first question I have really is, it's going to be for you, Beth, and that is that with respect to design and function in today's healthcare system, what's really been keeping it from being truly consumeristic in nature?
Great question, Stephen. There are a couple issues. The first one is there isn't a direct exchange between the provider and the consumer, right? The health plan's involved, employers are involved. So there's not that complete transparency like we have in every other aspect of our lives. Go to the grocery store, we see how much the price is, we know how much money we have in our wallet and whether or not we want to buy that product or good. With healthcare, we don't have that. We don't know what the price is going to be until after the service is rendered. And we don't always quite feel the pinch of the price because it's being funded by our employer. Now, obviously, some of that is changing with high deductible health plans, but I think the biggest thing is there isn't that direct relationship. The second thing is that lack of transparency. Really understanding how much something costs is really critical to being able to make good decisions. And I think the last thing I'd say quickly here is when you don't have transparency, you don't have truly that direct relationship, the consumer then is really not the one determining value. We have health plans that are determining on behalf of consumers whether something's a value. And quite frankly, there isn't always alignment between what a health plan believes or provider believes is value and what the consumer believes is a value. So several key things that I think are really a challenge to bringing true consumerism to the healthcare ecosystem.
Yeah, you brought up some great points. And I guess the follow-up to that would be, all that said and certainly all that known. And do you really see, Beth, that there is going to be a way to overcome this?
I think it can. I think we can make progress first by just bringing additional transparency to the table. And when I say transparency, it isn't just price transparency, but it's even transparency, for example, for employers to understand the flow of the money, right? How does a PBM make money? How does a health plan make money? How does pharma make money? A lot of that information is obscured. And as a result, all the players in the ecosystem aren't necessarily making the best decisions because they really don't know, because they don't have complete transparency. They don't know the money flow. And again, if you go back to a traditional transaction, you go in to buy a car, you understand that there's a manufacturer, a car dealer, and then you. And you know that car dealer is an intermediary. But they do show you what the manufacturer suggested price is, right? Which may very well differ by the retail price. So I think it's really bringing transparency to the table about where the money flows, and also that pricing is really critical. And we have to simplify too. I don't see any reason why we have literally hundreds of thousands of diagnosis codes, procedure codes. Why? This is just absolutely crazy. There's a real opportunity to simplify transactions. And if we can do that, I think we can start to have people then really become more competitive, and people can still compete on quality and cost.
Jared, I got a question for you specific to providers and payers, because I don't think this has really gone unnoticed by providers and payers. And in the last couple of years, one of the things that we're seeing more of is this term of being patient-centered, that care is patient-centered or service is patient-centered. And I'd like to ask you, is there a difference, the way you're looking at it, between patient-centered and consumer-centered?
I think so. I think patient-centered was a good start to thinking with the service mentality in terms of not being institution-centric. And I think consumer-centered is more encompassing than that. I think it includes everything that happens when you're a patient, what that experience is. But then I also think it includes the health behaviors and choices that are made prior to and after you're a patient. And for the majority of people, that is when we're making a lot more choices. It's not necessarily when we consider ourselves a patient, which is often when you're encountering or experiencing any time, whether it's virtual or face-to-face with the healthcare professional. Maybe it's an inpatient stay, you're an overnight stay at a hospital, or maybe you're just visiting the doctor, but having an encounter with the healthcare professional, that's when if we're really drilling down on the wording, that's what I envision as patient-centered. You're patient when those things are happening, but consumer-centered implies that there's a lot happening before and after that. It's more in line with the consumer's standpoint, because most people, depending on their disease state and what conditions and what their health is like, aren't necessarily waking up in the morning and thinking about healthcare choices they're going to make. They are going about their day, and things that affect their healthcare come and go, either expected or unexpected. And so consumer-centered to me just implies that a lot that has to do with and affects our choices for care happens when we're not being served as a patient at that time.
Gary, I know this is a topic that's a bit near and dear to your heart. You got some thoughts on it?
Yeah. First off, I just want to say to Beth that you can now buy cars out of a gumball machine too. So, I mean, we've transcended into an entirely different reality. The notion of consumer and patient centricity, I feel Jared and I are going to give probably the same answer throughout the podcast in just varying different ways, but is concentric to the history that got us here, right? And if you talk to a chief marketing officer over the last 10 years, they would say, oh, it's all about consumerism. But they very rarely found their inputs into the administration and the supply chain of a health system. It kind of stopped when their job was over. And then it became patient-centered care. We get caught up on the linguistics, but make no mistake, these worlds are now blurring right in front of us. And why? Why would that happen? Well, it's not, as Jared said, it's not an episodic thing. It's something much longer. And we take a step back and take a look at the big picture. Just like Steve Jobs used to say, you have to start with the full experience and back your way into everything else, into the technology, into the process. And we just can't do that as an industry. It's starting to change now. There's a reason I'm here at Innovators, because we're abiding to this law of consumer dynamics, which says you have to know me. You have to show me you know me, essentially, is the term. And in doing so, you have to know every single step I'm going to go through. And that's when the term patient, which, by the way, is an aged term that says I'm only there to cure you to take care of you when you're sick. Like Jared said, like that could be a window this big. What about everything else? The term patient, I see it having a very limited lifetime. It's got to get to the world that Beth described, transactional, commerce oriented. It's like oxygen. You're just in your health, and your health has 1,000 different permutations. You're a consumer of your health, plain and simple. So I see we're still in that world right now. There's still a consumer experience officer. There's still a patient experience officer, but eventually they have to combine to become one thing.
Beth, when we're looking at the different segments of healthcare, the different major segments of healthcare, your providers, your payers, your drug companies as well, where do you see them, maybe on a broad scale here, where do you see them getting consumerism right today? And then where do you really see them really just missing the mark on consumerism altogether? Do you have maybe thoughts on that?
Well, from a health plan perspective, for example, I do see improvements in technology, self-service technology available, so you don't always have to pick up the phone. Providers are still lagging there. I mean, they do have their portals, but they're still relying on the fax, which I struggle to believe that we continue to use that kind of technology. But they are trying to bring a little bit more technology to make things easier to the table. But where I still see problems is there's too much friction in the system. USA Today just did an article on a report that came out of HHS. And they had an investigation done. And basically 1 in 5 claims were denied by Medicare Advantage payers that would have been paid under Medicare fee-for-service. 1 in 5 claims. It was 18%. Furthermore, they said 13% of authorizations that Medicare fee-for-service would have approved, managed care companies denied. That's astounding. Now, we know that CMS gives some flexibility to health plans, but if you want individuals to come over to a Medicare Advantage plan, it isn't just about giving them some extra benefits like dental and vision. It's about making sure that I'm getting the Medicare coverage that I would get if I was on fee-for-service. And there's just too much friction in the system where we put it on the backs of the consumer to appeal the claim, right? Appeal the authorization, appeal the claim. And I'm telling you, I just went through this myself, and it was a 6-month ordeal. And guess what? I know what I'm doing. I know the codes, right? I get it. I understand it. It's a real challenge, and consumers are feeling that. And that's why I think some consumers are saying, maybe I should just stay in fee for service Medicare. And other ones are saying, wait a minute, maybe I should try one of these newer health plans that say that they're going to give me a different experience, or they're going to give me a patient navigator or member navigation assistance. We really have to step back and remove that friction from the system. I'll just share one thing really quickly. I moved to Florida. In Florida, apparently, you have to get a referral to get a routine mammogram. Now, I have not received a referral to get a routine mammogram. No health plan payer requires a referral for years. But not only was I told that I needed a referral by 3 different sites here in Florida, I was told to go to the prior provider and get a CD-ROM and physically bring the CD-ROM into the provider. And I'm like going, well, can't you get this for me? And I was told, we're too busy. That's the other thing. From a provider perspective, patients are tired of hearing, members and individuals are tired of hearing that their time is not as valuable as yours, because their time is valuable, right? It's why you have patient no-shows, because if somebody knows they're going to sit in a doctor's office for 3 hours and miss 3 hours worth of work, many people won't get paid for those 3 hours, right? So this friction just continues to exist. And, Gary, you talked about it. Jared, you talked about it. We need a consumer experience that respects the consumer, shares information that they know we know them, and care about them. And our healthcare system just isn't there. We talk that we want to get there, but we're just not there.
Yeah, Jared, you have some thoughts about this?
I do. I think they're pretty in line with Beth in terms of where it seems like we're seeing some success is that we are seeing more access in general to care. We are in general seeing providers and traditional health systems using more digital tools to make it easier to get a hold of a provider. That's not the case across the board, but in general, you can compare that to even a couple of years ago or several years ago, there's more access. There is more digitization of existing processes. And I make that distinction rather than calling that digital transformation, because digitizing the existing processes, while it can be better, those processes still might not be where we want them to be consumer grade processes, meaning that there's still the thought of, in a lot of cases, for admissions, when you check in, instead of having to fill out all the paperwork by hand, now you're filling it out on an iPad. But the question is, this is an example that's been used in the industry lately. If that still takes you just as much time to fill out all the paperwork and you just happen to be doing it on an iPad, is it really any better? And so I think you see the difference with one of those is really just digitizing an existing experience that is cumbersome. And so I feel like where we're falling short is still there are so many cases where encountering the healthcare system is still too hard, like period. It's just too hard. It's too inconvenient. It is scary and it's expensive. And that means people are putting off their care. We could go through many, 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 many experiences. We all probably have personal experiences of people who did not seek care, people who we know, and that affected them. And the reasons why, I don't blame them, for not wanting to seek care. It's hard. And like Beth just said, even when you know the cheat codes, like even when you know the language, you know what you're doing, it's still challenging. And so I think we have a long way to go. I think part of that recognizes that that there needs to be more cross-functional collaboration for that to happen, because it's not happening the way we are now.
This brings me to an area that I wanted to address with you all, and that is particularly value-based care. And Gary, I know it's a big initiative, obviously at Innovacer. I know that it's a big initiative in the industry, but I'd like to see how does consumerism tie into value-based care? Gary, I'd like to throw that question your way.
Yeah, sure. It's a great question, and one that I don't think has been fully realized just yet. The promise of value-based care was to improve, because the tied term to that is population health, was to improve the health and the sanctity of a given population, whether it be an underserved community, whether it be a non-fee-for-service like a Medicare, Medicaid type of environment, or a particular service that a health system provided, that they had a contingency for going after that service, whether it's oncology or some others. Maybe there's clinical trials or there's research that's coming out of it through an academic. Whatever it is, the goal was always to then eventually bring that to those to whom they serve. Well, that really hasn't happened yet. Most of the values and the metrics that are coming through are to support the system, the hospital or the health system. When we talk about reducing readmissions by 20%, that's a hospital value. When we talk about improving quality outcomes by 10%, that's a hospital value. Why? Why did those things happen? The next big push for those that have taken on VBC as a going concern, which is incredible, right? And we're just getting started, and this has got a long way to go to find some harmonics and balance between fee-for-service, because everybody would agree, like even that's teetering off the edge a little bit. So we have to find some sort of balance between these two worlds. But in order to do that, you have to eventually communicate to your consumers. Much of what Beth was prescribing in some of the previous questions was this nature of having the consumer having to respond to you and having to react to you. And I can't think of an industry where that's worse, right? And in every other industry, I can get my hair cut, and my haircut guy reaches out to me and he's like, "Hey, you got to do this, you got to do that." That's my haircut guy. Like, why? Well, how can the health system not be proactively monitoring my health in some sort of, mashup of different data sets that draw a persona and an X on that persona and say, "That's you, and we're going to help guide you through this." VBC that was supposed to be the rally cry. So the next big movement of that for consumerism is layering over communication on top of VBC. Communication protocols that are contingent to a journey within those worlds, within a given DMA, and personalize the you-know-what out of that, so that they know you're there, they know that you're listening, and that there's not only a clinical correspondence to that, but as kind of Jared alluded to, some perhaps there's behavioral, and there's the stuff that are on the outer perimeters, and we're bringing those in as well. That has to happen. And that's the next big movement for value-based care. Everybody kind of knows that. People are kind of struggling the best way to do it. But communication proactively, not reactively, is that next big shift that I see.
Beth, I'd like to get your perspective on that same question, particularly having many years on the payer side. What are your thoughts around value-based care and consumerism that tie in?
Yeah, there are two things that I really appreciate that value-based care can bring to the table. Number one, if you're thinking about a bundle or an episode, now you can have a very transparent flat fee for the member, right? And they know what they're going to get. Think about a pregnancy. If you are pregnant, you are going to go to the OBGYN. They're going to deliver your baby. You're going to get 1 or 2 ultrasounds. It's all included in that bundle, right? And you know what your copay is. Your copay applies across that bundle. I think there's a real opportunity here, as opposed to, gosh, I get the surgery and now I'm going to get something from an anesthesiologist and then the surgeon and then something called a hospitalist. What is that? What is that, right? Because you're in the hospital, you don't know all these people that are seeing you. That's number one. The second thing I love about value-based care is it affords the provider the opportunity to do what's right without having to worry about whether he or she can bill for it. Because if you're taking global risk, as an example, like many of these primary care providers do, especially for the elderly, right? There are things you're permitted to give to a member, one of your members, that a health plan can't. Because if the health plan did it, it would be considered an inducement. But if you're a provider, you can buy somebody a meal. You can actually pay for pest control. You can do their laundry if that is literally a problem or a barrier as a social determinant to them being able to get better. under a health plan, there are many things like that you still can't do. So value-based care really aligns what the provider truly needs to do to help that individual with the ability to do it without any repercussions that there's some type of inducement going on. And so I just really think that is so powerful because that's what you want. You want the provider to do the right thing and not say, I can't do it because I can't bill for it or because Medicare won't allow me or the health plan won't allow me to do it. It's just you're doing the right thing for the right reason. And I think we'll see more of that as we see value-based care grow.
Yeah, it's so interesting you bring that up. Today when they talk about, or when it's talked about personalized medicine, personalized care, it always seems to be sort of framed around personalized clinically. But in here, you're really talking about personalized for the barriers that an individual would have, and then really kind of recognizing, right, and sort of filling those gaps to get things started, to catalyze, the efforts that need to be done. That's what you're saying, right?
Yeah, let me give you one really quick example. Oftentimes we think transportation, that's a social determinant. And so what we plan for is I can take Mrs. Bierbauer, I can get her a ride to the grocery store. Well, maybe Mrs. Bierbauer can drive, but what Mrs. Bierbauer can't do is lift those heavy cans of Ensure that her doctors ask her to take and carry them into her house. When you're operating in value-based care, you can actually pay somebody to go and take the groceries out of the car and take them into the house, right? You don't, because Mrs. Bierbauer doesn't need the transportation. So that's the personalized care. That's truly solving, and Jared was getting this, the true problem that the customer has, right? And that's what value-based care allows you to do, to truly meet that individual's need in a way that makes sense to help improve their health.
Gary, I know that at Innovacer, you're heading up patient relationship management. And I'd like you to connect the dots, if you could, on where you see patient relationship management, not just serving patients, but really meeting and serving the needs of the healthcare consumer.
These sorts of tools are meant to serve as patient relationship management is meant to serve as an umbrella over countless processes and sub-processes that cut across three primary domains, and what it's kind of rationalizing itself out to be: the notable consumer experience, which in the hospital world, in the health system world, use a term like access, like these big scary words. Nobody knows what they mean. And I be granted access into the system, right? And then when I'm in there, I'm in the clinical arena, and then after that, I'm in some sort of wellness arena. And again, we use terms like value-based care and population health to kind of satisfy that interest. But how do all those three get united? Because there's countless handoffs throughout that entire process. And if the North American health system has proved one thing, it doesn't do a good job of handing off. The transitions, or the terms we use, those transitions might as well be canyon-esque valleys that you're left to your own druthers. You have to figure it out. You have to call back several times. You have to remind them that this is what happened on the last call. You have to do X and then go back. It's like a Wonkavator. I go up and I go down and I go all over the place. Right? There has to be a mechanism that cleans that and satisfies that. That's what CRM tools, patient relationship management tools, are meant to do, where they establish a longitudinal connectivity from action to action to action. And they jump in and jump out of several different departments simultaneously. They might start with marketing, might move to a contact center, it might go into insurance might go into coordinated care might go back to insurance, then into referral management, and so on down the line. And all these terms are now getting, and all these departments and all the data and all the processes are now getting connected in a sequence. And if the backbone of that patient relationship management or CRM system is data infused and it's not just on screen, then it becomes malleable. And that's when it really gets interesting, because once you're able to create malleable, longitudinal, again, using that term, journeys, then they build on the fly. And then you don't need to really be mapping journeys anymore, because that's a big thing. They just happen. But you have to find for which service line and for which system they need to be designed accordingly, because everybody does it just a little bit different. But that's what those tools are meant to be. And then communications, content, messaging, and process all get aligned, and they're driven by some sort of backbone of data that's just ironclad and almost never wrong. That's where the next 3 years is heading, is to kind of rationalize to that kind of solution to deliver what we've been waiting almost a decade to be able to do.
Beth, I'm going to throw this question at you. And having been in healthcare myself for over 30 years and seeing the changes that have happened, one of the areas in healthcare that appears to be almost taboo to talk about, to address with healthcare leaders, is prices or pricing, the level of pricing. And in particular, I wanted to address this with you, Beth. Do you see a time where prices in healthcare, whether we talk about healthcare services, healthcare coverage, drugs, do you see a time where prices are ever going to come meaningfully lower? And if they don't get lower, can we really have true consumerism existing in healthcare?
I think that prices will get lower once we start sharing them. And I know a lot of folks are very nervous about sharing prices, which they are now obligated to do, as we know. But do you know of any other industry when prices became transparent where the prices went up?
I know.
No, people said, wait a minute, my competitor on the street has a lower price. What can I do to be more efficient? What can I do to be differentiating and at least share my value, right? So I really believe this transparency of posting prices, number one, and then number two, truly playing on the retail game as opposed to rebating. And again, what I said earlier, things that happen behind the scenes. And I'm not saying that that's wrong, so don't misinterpret me. But when you really can't see where each of the pieces of the money go, you can't compete. So I think bring it into a true retail environment that says, here's how much we charge, or here's the discount we give to your health plan. Yes, that means that health plan A will be able to see what health plan B pays a particular hospital. But my guess is going to be when that happens, they're going to start to say, wait a minute, I either have to justify my higher price or I have to become more efficient. Because what we really want, and the way that to me is optimal, is that you really want to make sure that you're going to the facility or to the provider that is the best at something, right? So you're willing to pay more for that because you know that it's better outcomes. You don't always have to pay more for better quality, but get the price out there, get the quality statistics out there, and you will see, I think, the market explode. We're already seeing this in consumers with companies like GoodRx, right? How many consumers are not using their Medicare plan, are not using their health plan because it's less expensive to go pay cash through GoodRx for a drug than it is through their health plan? Because the health plan, you're paying your copay or coinsurance off of the retail price, and there's a rebate happening on the back end. So oftentimes what you're paying out of pocket is higher under your health plan than what you're paying under GoodRx, especially when you're talking about specialty drugs and things like that. So bring the prices out, bring the qualities out, show your outcomes. And I think it's a game changer. I really do think it's a game changer because providers are very competitive.
Yeah.
They want to be the best, right? And they will compete when they know that they're not as good as somebody else. They'll either sit there and say, you know what, maybe we should stop doing heart surgeries here and focus more exclusively on maternity and orthopedics because we're really, really good at that. And that's where you'll start to have what some of you may remember Regina Herzinger at Harvard, those focus factories. People will get better at what they do. And the market will, I believe, will be better off for it.
Yeah, that it just brings me just to a very quick follow-up, and that is that, we use this term consumer, and it seems to me that it seems to always be attributed to patients, but it almost rarely, if ever, gets framed around self-insured employers, which obviously, they're just as much and certainly probably more of a payer than the average individual. Beth, so I guess my thought would be when you talk about transparency, how do you see self-insured companies, being able to really have leverage on that, as well as, individuals?
The self-insured employers have been buying services over and above what their health plan offers, these point solutions, because they believe their health plans are not necessarily bringing to the table what they want. So a large self-employer will have their health plan who will pay claims, but then they bring in an accolade, right? To help their employees navigate the healthcare system. They will bring in a third bridge or a Carum Health to bring these very specific networks around orthopedic surgery or heart surgeries or things like that. They will bring in their own telehealth provider. They'll bring their own mental health providers in. So large self-funded employers have been trying to bring transparency and improve the healthcare system on their own, where they've seen these deficits with their health plans. And again, this is not a knock on health plans. I come from the payer perspective. I'm just sharing with you that when people see a gap, and large employers are seeing that, they're not going to sit back and do nothing. They're going to start to bring in these point solutions. And we have just seen it. And I don't see any end in sight for now, because they're just saying, I need focus on these areas where, to your point, Steve, costs are skyrocketing. So they are consumers as well, and they are taking action.
Jared, I know you have a background, especially with your show, Healthcare Wrap. You talk quite a bit about the retail companies, the non-healthcare retail companies that have really grown in terms of providing care services. You look at Amazon, Walmart, CVS, although you could argue CVS might certainly have been healthcare before. And, you're seeing more and more of this from the retail end. As a whole, I'd like you to maybe explain from your perspective why this has really grown out, and just maybe elaborate a little bit more on retail companies getting into healthcare.
You bet, Steve. The reason, in short, why retail companies are coming in and succeeding in capturing market share is that they know how to meet and exceed consumers' expectations for the experience they're going to have. They come in with a consumer-centered mindset and a business model and data, and they use those retail chops to come in and address just the part of the value chain that benefits them. They don't often have the same restraints and constraints as a medical institution. Walmart Health was free to come out when they opened up their initial clinics, and they just posted all their cash prices. And right off the bat, everyone knew exactly what it was going to cost, and this was it. It was a posted price. You could go to their website beforehand. You actually knew what it was going to cost you, and they were competitive prices. Amazon has an online pharmacy that you can go and check the prices for the same prescriptions that you get elsewhere. A lot of times they're cost less, but they have it all right there. You can shop it. You can look online. A lot of these retailers, they use this mindset. They have decades of experience addressing consumers. And when they were not in the healthcare game, some of these players, they knew exactly what they were doing. So they're in the habit of communicating, engaging with, gaining the attention of, making it clear what they're doing to help serve somebody. It's clear in the majority of their communications and their marketing and advertising. And what's interesting is that people in general, with any kind of healthcare experience, with any encounter with the provider, generally give high scores to the care itself. So the encounter, with the care they actually received from their healthcare professional, in large part, they give high scores for that. Where they rank things lower is other parts of the experience. So I didn't get my bill until weeks later. I didn't know how much it was going to cost. It was really inconvenient. Someone was rude to me. It was hard to schedule the doctor. I couldn't get in for 30 days, So other parts outside of the care itself, these retailers can come in and they know exactly how to address those parts where they're seeing these low scores across the board for providers. So what we've seen on the other side of that is an acceleration of the expectations that we bring into any healthcare encounter. And we can point to any number of circumstances that have happened over the last couple of years that have led us to have a higher expectation. All of a sudden, our favorite restaurant that we went into a couple of years ago that we couldn't go into anymore, they all of a sudden turned around and offered curbside service, and they made it easier to deliver to you. And they created digital experiences and digital versions of the things you're used to. Even banks, a traditional institution or industry like banking and financial services, they figured out how to make things easy. They still needed you to engage with them, and they figured out a lot of digital tools to use to make that possible. So I just think there's a lot to be said for it. When you think about what these retailers offer outside of healthcare as well, convenience, ease, personalization, transparency. Yeah, those aren't necessarily the historical priorities for healthcare providers and medical professionals. So I think there's a lot to keep your eye on, and I don't even know if it'll be the current slate of players that ultimately succeeds. But we need to keep an eye on cumulatively, what is that doing to our expectations as healthcare consumers?
Gary, one of the things that I particularly have an interest in is certainly data in how healthcare is transforming. How do you see data as a whole playing a role in empowering or strengthening consumerism in healthcare?
There was a period in like late 2018 into 2019, and then I think accelerated, where you saw companies, large data warehouse companies, driven by significant amount of machine learning and next generation data models, companies like Snowflake and Databricks. These are some of the largest IPOs ever for software companies, began to kind of shatter, not to use that term again, but kind of break ceilings of acceptability in terms of what you needed to do to reach consumers better. And these are large super brands working with these organizations, and they're supposed to know what they're doing. So I think that movement now is happening here. And you're talking about not rebuilding, but kind of consolidating and standardizing over 30 years of fragmented data repositories. And you're talking hundreds of different data centers across your average health system that basically all have a different interpretation of you. That is all now coming together, has to be cleansed, kind of ratified to a degree, to a quality matrix that allows you to do everything that we're talking about. If you don't do that first, there is not one thing on the table that we're discussing today that you can perform. It has to be rooted in some sort of consistency and reliability when it comes to, again, show me, you know me. In order to do that, you have to have a single record of who you are. Like, this is just table stakes, bottom of the first inning kind of stuff. But here, we've passed the line so far in terms of its feasibility, in terms of it being correct, that we're having to go kind of back in time and then coming forward again. So it's huge. It's everything right now. It's where almost all of my focus is, and will be probably for the next 12 to 18 months.
And do you see the single longitudinal record for patients? Do you see that containing consumer data? Yeah, consumer data where a person, let's say, does their grocery shopping, or what they buy when they grocery shop, or what they buy when they make other purchases outside of healthcare. Do you see all that wrapping into that longitudinal record?
Absolutely. Absolutely. And I'll go back to what Jared said. Jared talked about like the middle window, that clinical window, which constitutes a very narrow percentage of your health time, right? That acute. And that's how we've always labeled it. Well, what happens before and after that? That's your life. That's your health life. That's far more important than how you got fixed. I mean, don't get me wrong, that's important. But how do you prevent that from happening again? What is your mental status? What is your family status? How do all of these intersections of where you live, how you travel, all the little nuances we talked about bake in to become a you that they can interact with on a one-to-one basis? And that, so it's not just consumer data. It's mental health data. It's behavioral data. It's shopping data, commerce data, the speed of urgency. Like, all of these things go into a fabric of you and understanding you. And nowhere is it more important than here. And it's just lagging forever. So that persona of you does have to include a consumer-centric version and a patient-centric version at the highest of standards, working on multiple levels simultaneously. And then and only then can a lot of the machines that we're building in the background, designate then how to interact with you. There's no more greater focus right now than kind of bringing all of that together. No matter where you are in this space, this is job number one, hands down.
Beth, I'd like to get your point of view on payviders. And in particular, maybe just giving a very high level explanation of what a payvider is. And then ultimately, do you see the emergence of payviders helping or hurting consumerism in healthcare?
Sure. A payvider is a provider that assumes risk, and they can either become a full blown health plan, or they could be accepting global risk, for example, from the payer. We're seeing more and more payviders enter the system. As an example, for January this year, Ochsner Health Plan, Ochsner used to have a health plan. Now they reinstated and created a new health plan. They had sold their previous health plan. They have a new one for Medicare Advantage members. So they are a payvider. Intermountain, Kaiser, UPMC, these are all classic payviders that have a full-blown health plan. But I also look at companies like Oak Street, Village MD. I consider them payviders as well because they're taking global risk. And consumers typically really like their payvider plans, especially Kaiser, that's been doing it for a really long time, because they don't see it as their health plan. They see it as going to their doctor, right? And it's a very seamless experience, like Jared and Gary were talking about. I pay my copay and off I go. They also allows you, I think, to have that flexibility, particularly the providers like the Village MDs, the Oak Streets that are taking global risk, gives you that flexibility to do, what it is you need to do for the member. One other example really quickly, Geisinger, right? Geisinger Health Plan is both a health plan and a health system. They've been able to do some really innovative things over the years, right? They were one of the first to get out there and start helping folks with diabetes by actually giving them food, right? And to help manage their diabetes. They were, I think, the first out there that said, we are not going to charge back to our health plan if we have to readmit you for certain conditions within 30 days. That's on us, and we're not going to charge the health plan again, right? So I think there's a lot of really neat things that payviders can do. So I think it's really exciting, and I think competition is always a good thing.
Jared, I know on your podcast you talk quite a bit about changing the design of healthcare. And a lot of times, as I've heard you say it starts within the companies itself. And so with that being said, what sort of changes in business roles or role titles or responsibilities do you see as really needing to happen to help catalyze consumerism even more, whether it's with providers or payers or any organization in healthcare? What sort of roles do you see needing to evolve more?
So, I think back to the early days of before we had chief digital officers, or before we had certain roles within marketing organizations, and SEO used to be just one tiny thing that a marketing leader would be involved in, and now there are roles and teams and entire industries dedicated to that. I feel like we're at the cusp of something like that will take some time to be adopted in a widespread way, but there's something to be said for having a role for consumer strategy, and especially when we're talking about traditional provider organizations, where that is not typically covered as its own function. And so the need right now is to develop leaders who have a very cross-functional mindset. I mean, you think about the competencies and skills that you need to provide a greater consumer experience. It's a cross-functional role. It's equal parts human-centered design, digital and tech, finance, and marketing. And you might ask, why those four things? Well, human-centered design, because first and foremost, we have to design something better, which means that you're putting the consumer at the center of the change management process. There's a whole set of skills and frameworks that are used under that umbrella of human-centered design. And it's typically something that happens in pockets, but it's not widespread and mainstream across an organization. But that's what you need as a skill, at the very least, to design a product or experience or a service that does have the consumer in the middle. Then once you've designed it, you need very deep understanding of the digital and tech tools, to build that experience and build that service or product that you're talking about. You're almost always connecting data sources, like Gary's mentioned, and you are the building is very robust. So you need a very specialized set of skills and understanding there. Then you need finance because the economics have to make sense. You have to provide a growth track, like the service or product that you're talking about. All the players involved have to benefit from it, or else it won't make business sense. It has to make business sense in order to be justified. And then finally, you need marketing chops because you're going to be influencing consumers' behaviors. You need to understand them and be able to engage them, open a conversation, and explain to them what their choices are. And you need to listen to them and know all these basic functions of marketing. So wherever that sits, I think this conversation is just now beginning to happen in the industry, but I expect to hear more about it, about what a consumer strategy role might look like, and see that enter the conversation. It'll probably be called something different. It'll probably be something related to that, but this combination of parts that have traditionally been housed in different departments that don't talk to each other a lot, I think we'll see a lot more of that.
If you could snap your fingers and have just one change made that could strengthen consumerism in healthcare, what would that one single change be? Beth, start with you.
Well, I'd probably go back to my transparency statements, really saying, show me the prices, show me the quality as you define quality, and then show me that you will incorporate my opinion of quality as the person who's going to be consuming the services. So I just think that transparency is so critical. I want to know how much you're going to charge me. I want to know how good you are at it. And I want to know how you're going to treat me as a customer. Very simple premise.
Jared?
I think I'd just say that the industry will welcome the changes that are coming and will take the lead rather than resist it. We saw organizations resist digital transformation for decades, and we saw where that got them. It didn't get them to where they just thought it was going to be a fad or something that went away and they could just stick with business as usual. And so I'd love to see it happen sooner rather than later. And I'd love for the existing players and leaders in the industry, whether that is the medical profession, the medical institutions of the world, or other players who are incumbents and in strong market positions right now, that they would see the value of partnering together and taking the lead and not resist it, because that'll get us there a lot sooner.
And Gary?
Yeah, for me, it's always a little bit of go big or go home. But I would love for every single person in the U.S., all 350 million of them, to know that they are in charge of their own health, top down. And what does that mean? It's not your provider. It's not your payer. It's not CVS. It's none of them. Although they stake claim to be the greatest, practitioner and the greatest supporter and administrator of your health, they don't own your health. You do. I don't think everybody gets that. And it's again, it comes back to all the things that we've talked about in terms of things being more open. And when things are open, the control comes back to the consumer. And control is a strong word, but it's really what it is, particularly when it comes to your health. And it's not just riding on a Peloton. It's not just having, your Apple Watch and working out and tracking all of that. Like, people are like, well, that's what I do, and that's part of my health. Yeah, but managing your health is a lifelong exercise that cuts across a significant number of boundaries, both known and unknown, for those born and unborn, because your life can become somebody else's life, and then so on down the line. And how does that get kind of controlled and owned by you? What mechanisms are most put in your hands for you to be able to do that? And we are far, far, far from allowing that to happen. There's no killer app. There is no transcendence universally across the country on a standard model that is again 100% customer centric. Many are trying and dabbling in it, and beginning to say that they're on that movement, but it's slow. It's got a lot of broken parts that continue to kind of show up again and again and again. But again, snapping the finger, it would make life a lot easier if the culture of the U.S. and globally, quite frankly, knew that they were in charge, and to begin to kind of force that change from that angle, that would help speed things up significantly.
I want to thank the panel today for taking their time and sharing their great insights. Beth, Gary, and Jared, it has been a privilege and a pleasure. Thanks so much for coming on the show today, and definitely looking forward to doing it again.
Thanks for having me, Steve. I really enjoyed it.
Thanks for letting me be a part of this.
Thanks, Steve. Great job as usual.
Thanks for tuning in. If you like what you heard, please spread the word. Tell your colleagues to tune in for all the awesomeness, then leave a review on Apple, Spotify, or wherever you listen. This show is produced by Shift Forward Health, the channel for changemakers. Subscribe to Shift Forward Health on your favorite podcast app, and you'll be subscribed to our entire library of shows. See our full lineup at shiftforwardhealth.com. One subscription, all the podcasts you need, and it's all for free. And remember, we might have a lot of work to do in healthcare, but we'll get there faster together. Thanks again.